Community health workers in Uganda work as members of the village health teams, Vhts. The Vhts program was established in 2001 as a cost-effective way to link communities with health services. They support the Ministry of Health to bring health services closer to the population. Vhts have recorded a couple of challenges like lack of allowances, transport, and most of their work is paper-based. Experts believe that some challenges can be solved if they digitize their efforts.
You cannot come over a river or a lake and you arrive and you do not have gloves and you're not able to look after a pregnant woman. Moreover, these Vhts have to collect all this data and then prepare it for reporting. Many of our Vhts have not had formal education beyond primary school. And so analysis, data collection, reporting does not come easy and natural for them. We think that these problems can be solved with a digital solution.
Dr. Ronald Miria, the Minister of Health's lead strategic health communications officer, claims that resources are being mobilized to digitize village health community efforts.
It costs quite some money. Government cannot work alone in this. So we call upon partners of goodwill to be able to mobilize resources, which resources they can then channel to government or can be directed by government how best to implement this. And I think if we put our heads together, which I know is the way to go and which I know the goodwill is there, we are really getting there.
Working in close collaboration with the Uganda Ministry of Health, UNCDF has supported partners BRAC and MEDIC to configure and deploy a digital system that promotes community-level health service demand creation, integrated healthcare coordination, and performance management.
When they are visiting a household and collecting records, how can that go from a book to a digitized record that can immediately be seen at the district level? So they're really simple digital solutions that can enable that connection to happen between somebody who is very remote with the rest of the system. And there are a number of digital solutions, like they told you earlier today, how you can equip a village health worker with such solutions that can really enable them to connect seamlessly for purposes of communication, for purposes of record keeping, for purposes of training.
So as partners implementing for community health, one of the core pillars that we advocate for is compensation. I think Vhts have been great volunteers for such a long time. But as a country, we need to make a decision to increase their motivation by determining a level of compensation that rewards their effort and their voluntary work.
Together, BRAC and MEDIC are implementing a 3-year and 5-month public sector project funded by the United Nations Capital Development in 4 districts of Uganda, that's Lira, Koboko, Maracha, Nebi, targeting 400 Vhts. The project aims at piloting and scaling sustainable health solutions that will improve service quality, productivity of the village health teams. Pedson Mumbere, Smart 24 TV, Business Today.